So the Children's Treatment Center is part of the Sudbury Regional Hospital. We provide services for children who require physiotherapy, occupational therapy, and speech-language pathology. So these children may have very simple problems, like they may be walking on their toes, to very complex problems like having spastic quadriplegia, cerebral palsy, or autism, or significant developmental delays. And so it's our role to assist these kids reach their full potential. I'm the social worker at the center, and I'm also the intake coordinator, so I do two main things. One is, as the intake coordinator, I'm the person who receives all of the referrals. We accept referrals only from physicians at our center, so I review them all and determine if they're appropriate. I'm also the contact person for parents for the time that their child spends on our waiting list, because unfortunately children sometimes have to wait for services. And so that's part of what I do for intake, and I meet with children who are referred here on an urgent basis. I'm often one of the first people that they meet when they come to the center. And so my role as a social worker is to support families in their journey. Many of the children who are referred here are diagnosed with very significant conditions, and this can be life-changing for our families. So my role is I'm there to support them. I may do things like organize meetings. If there are lots of disciplines and lots of professionals involved, sometimes it's important that we all sit down together and review the child's needs. And that may include daycare staff, that may include physician and parents and the school. I provide counseling to our parents, and so I may see them individually or as a couple or as a family. I run some groups, which I think is a very important part of allowing our parents to meet other parents who experience many of their same experiences.
I have identical twin boys, Scott and Ian. They're 11 years old. They have quadriplegic cerebral palsy, which affects all the muscles. So they're not walking and they don't talk, and they're completely G-tube fed. Well, we've been through all the programs in CTC. We went through TIPS, which is the toddler program. We went through PATH, and then we went to the school system. We've received occupational physiotherapy and speech therapies. Now we're in the school system. We receive occupational therapy and physiotherapy, and we are seeing the augmentative communication clinic, which is now we have what is called a digital board, where it's a communication device that allows them to scan auditorily what is being said, and then they make their choices. Well, when we first started with CTC, we had a social worker, and we did have a group that met about once a month. We've been doing it for about 4 to 5 years, and we started with parents with newly diagnosed children, just so they don't feel alone, and they can share their stories and just get to know other people, and just to break down a little bit of the misconceptions, and just to have someone else hear your story and that is empathetic towards you. Because sometimes you can tend to feel like you're alone and feel like you're isolated. And you do tend to isolate yourself as a special needs parent, just because you don't want your child to get sick, or you're so focused on the therapies, that it's nice to have a group where you can talk and everybody speaks your own language. Well, first of all, be kind to yourself and your family. Be forgiving. Take in as much information as you can, go home, follow through with the suggestions. If you're unsure, ask questions. The therapists are always here to help. They haven't just helped my kids. They've helped me, they've helped my family. It's a big support system, it's a big support group. Coming into the center, I was scared, I was nervous, I didn't know what I wanted, and I was in huge denial. And I gave a lot of people a really hard time. And now I've come to realize that they were all here to help me. And I consider a lot of these people friends now, not just therapists. they treat you with dignity and respect, and they allow you to grow as an individual and get used to the idea. And the physiotherapists, the occupational therapists, the speech language pathologists, they all work together, and they look at the whole unit, and they help the whole child. That's what I like about the center. You will have bad days and you will have good days, and soon the good days will outnumber the bad days.
As an occupational therapist, we work to help kids become as independent as possible with the activities they need to do in a day. Anything from self-care activities like getting dressed and feeding, and also things like fine motor skills, printing, cutting, coloring, those kinds of activities. We see kids of a variety of disabilities, and it's any difficulty they have, just trying to help achieve independence in those and other areas as well.
Well, it started off, we had an interview, an intake interview where we met with Joanne, the social worker here, and we also met with a physiotherapist. And so that's how it started. For our first couple months here, we did a treatment block of physiotherapy where we would come, I think it was an 8-week block, we would come once a week, and we would go through an exercise program with Bennett. The physiotherapist would show us things that we could do with him at home, stretches that we needed to do. And we would go home and work on that and try to meet some of the goals that we were setting. I think one of the biggest things as far as therapy goes is to become as involved as possible with your therapists. Find out what you can do at home, little things that you can do to incorporate therapy into every part of their day. Encourage other family members to get involved in that therapy program. Follow through with the goals. And most of all, realize that it's a slow process. Some things they will achieve, some things maybe they won't achieve, but it's all worth working towards anyway.
We work with children here at the Children's Treatment Center who are having difficulty with speech or their language, social communication, or feeding or swallowing difficulties. Initially, we do an assessment of the different areas to see what the area of difficulty is. Speech skills would include things like a child's speech sound development, so how they make sounds. We would also look at their oral motor skills to see how their lips and their tongue are moving to make different sounds. We also look at their voice and fluency, which is also known as stuttering. From that, we have our evaluation and find out what we need to work on. For their language skills, we look at their understanding of language. So for example, their ability to follow directions, understand concepts, and their expressive language skills, which includes their ability to express their ideas, whether they're using gestures or signs. Some children would be using photographs or pictures or a voice output system as a way to be able to express themselves.
The Children's Treatment Center worked very closely with her pediatrician. At first, when we came in, we were outpatient. So we'd come in about once every 2 weeks, and we'd see somebody who would help us do some exercises for her. Her first exercises were just very, very basic. They were getting up, sitting down, reaching for a toy. And I have to say that at the CTC, they always make it, it always never seemed like work to her. When I saw the change, it's really heartwarming to see that what a person can't do before can now do a few months later. It is a long road, and we realize for her, it's going to be not just an issue for when she's a child, but it's going to carry on for when she's an adult. So she needs a good foundation, and she needs a good start, and I think that the CTC helped a lot.
Physiotherapists at the Children's Treatment Centre are licensed healthcare professionals regulated by the College of Physiotherapists, Ontario. Here at the Children's Treatment Center, we treat infants, children, and adolescents with a variety of neurological, orthopedic, and cardiopulmonary conditions. We work closely with families and caregivers in order to incorporate activities and exercises into a child's daily routine in order to help develop gross motor skills, such as lying, sitting, crawling, standing, and walking, strengthen muscles in their arms, legs, and trunk, stretch tight muscles, improve their gait pattern, assist with pain management, improve posture, assist with balance and coordination difficulties, as well as foster independence with activities of daily living.